All right, we'll get underway. So on behalf of Barwon Health Foundation, a big welcome to our webinar on all things McKellar Centre. And it's really great to have such a large audience joining us this morning, hopefully for most of you on your last day of lockdown. Please let me start with the Acknowledgement of Country. We, the Barwon Health Foundation, acknowledge the traditional owners of the land, the Wadawurrung people of the Kulin Nation. We pay our respects to the elders, both past and present. We thank the traditional owners for the custodianship of the land and celebrate the continuing culture of the Wadawurrung people, acknowledging the memory of honourable ancestors. We also welcome all Aboriginal and Torres Strait Islander people joining us for this webinar this morning. Now, today is being run as a webinar, so you can only see myself and our special guests. We can't see you, but you'll be able to participate. We encourage that by clicking on the raise hand button towards the bottom of your Zoom screen. And subject to time, we'll try and unmute you and get your questions for our guests. Alternatively, you can type in a question by clicking on the chat box. Certainly, this latest lockdown and all the talk of how infectious this new strain is a stark reminder to us all that there's no room for complacency. And whilst complacency is a danger, it's also apparent there's no need for unwarranted community fear. And really, we follow all the advice we're given by authorities to social distance, mask up, and do all the right things. And of course, book in and get your vaccination. We should all be fine. Now, I understand the number of infections for yesterday in Victoria was 2, and locally, many of us would have seen firsthand the great setup that Barwon Health has established at the Ford factory for the vaccinations, and it really is such a smooth, easy process. So if you're eligible, please book in without delay. We're also reminded in these times that even in pandemics, even in lockdowns, babies are still being born, accidents are still happening, requiring emergency care. People are still having heart issues. The Andrew Love Cancer Centre is still busy looking after patients with cancer. Mental health is still an issue that requires attention. Cutting-edge research and clinical trials are still taking place. And at the McKellar Centre, first care is still needed and provided for our aged care residents, our palliative care patients, and the countless number of patients, both young and old, who still require their rehab. It's more than obvious that we should be extremely grateful for the amazing health service we have here in Geelong, not to mention the extraordinary healthcare heroes, incredible clinicians and researchers. And as amazing as this health service is, it wouldn't be what it is without the wonderful support of you, our community, and we thank you most sincerely for your support. Now, we've got some really great guests with us this afternoon. We might just say a quick hi to them all now. David Drummond has served as the Coordinator of Spiritual Care for the McKellar Centre for the past 12 years. While principally working in our residential aged care facilities, he also offers support to our inpatient rehab facility. While his greatest concern is for our residents and patients, he also offers support for both our staff team with all they have faced through their work and the COVID pandemic, and for the families of our residents. Morning, David.
Thanks, Francis.
Jacob Beard's role as Director of Capital Works at Barwon Health is to provide direction and management for a portfolio of major capital works right across a project life cycle from early planning to delivery and commissioning of the new facility service. Welcome, Jacob.
Good morning.
Morning. David Mead is the Co-Director of Community Health, Rehab and Palliative Care at Barwon Health. One of his main responsibilities is overseeing the operations of the McKellar Centre in Geelong. Thanks for joining us, David. Morning. And Ange Irwin has responsibility for the Aged Care Directorate alongside the Clinical Director, Rob Mellon, and has over 30 years experience in aged care, working across public, private and not-for-profit sectors. Pleasure to have you here, Ange.
Morning.
Good morning. And next we have Samantha Butcher. Now, people often ask Samantha, who's the Director of Canny Advisory, why she is a financial advisor, and her response is always the same. She loves getting to know people and creating long-lasting relationships in which she continues to help them financially along their life journey. With over 20 years experience, Samantha has built up a wealth of knowledge and experience whilst helping her clients prepare for and enjoy retirement. Really appreciate you joining us this morning, Samantha.
Thanks, Francis. Thanks for having me.
Good. And last but by no means least, Zoe Waters. For the last 17 years, Zoe has worked for not-for-profit organisations, all of whom have a common priority to improve the health and well-being of our community. She's spent time working within the mental health sector, child protection and children's rights, and for the past 10 years in public health. And she is the Executive Director of the Barwon Health Foundation and sets an extraordinary, committed and compassionate pace, leading the foundation to be Geelong's charity of choice. Welcome, Zoe, and happy birthday for yesterday.
Thanks, Francis.
Now, when we were planning this webinar and thought we could combine the tax appeal message together with some financial advice as we get towards the end of the financial year, plus tackle the past, present and future of the wonderful McKellar Centre, it all seemed like a good idea. But in hindsight, we may have bitten off a little more than we can chew, and certainly we could easily spend a full hour or more with any one of our guests on their own. So we apologise in advance to our panel and everyone joining us for the brevity we tackled today's webinar, but we'll try and power through. So let me just set the scene and wind back the clock to the beginning of the health service in Geelong. It's quite extraordinary that it was just 16 years after the first settlers arrived in Corio Bay that a public hospital opened its doors. As far back in our history as the 1840s, the men and women of Geelong were showing concern for the poor, the ill, the disabled and the aged. The Geelong Hospital was built on the legacy of community, giving plus amazing community leadership and passion for the region. In February 1848, at a public meeting, 130 members of the community supported the motion to build a hospital. A committee of 27 well-known citizens, with the Reverend Andrew Love as chairman, a familiar name to us all, set up an appeals committee to establish a hospital. Not long after the appeals committee was established 170 years ago, Tim Malloy was a shepherd roaming the hills of a property on the outskirts of Geelong. One hot February day in 1849, Tim was tragically bitten by a black snake, and as he was dying, he wrote his will on a scrap of paper, leaving his income of 12 shillings and sixpence a week, his home in Britannia Street, West Geelong, and all his possessions to the much needed hospital in Geelong that would be built as soon as enough money could be raised. The will was witnessed by his boss, first settler and landowner John Cowie, and the very first bequest was received for our hospital. And our Bequeath Society today is named in honour of Tim Malloy. Just a few months later, Governor Latrobe visited Geelong and granted the present site, bounded by Ryrie and Swanson Street, as a place to be gazetted for a hospital. The pier was run across the district through schools and churches, and the Victorian government was also asked to contribute £1,200 to match the contributions raised quickly by the community. In May 1850, the foundation stone was laid by Governor Latrobe, but in August 1851, so some 18 months later, gold was discovered near Ballarat, and it was impossible to find tradesmen and labourers, and the building was delayed, and the doors were finally opened in April 1852. For 71 years, the Geelong Infirmary and Benevolent Asylum was both a hospital and an old folks' home. In the infirmary, there were inpatients and outpatients, with the most common ailments being fractures, diarrhoea, dysentery and scurvy. In the asylum, there were patients known as the benevolents. They were the destitute and often elderly people of Geelong. There's quite an amazing history in this period around the hospital. Lord Kitchener, Percy Baxter, Governor Latrobe, plus many other notables and characters, and extraordinary and very inventive fundraising efforts that I'd love to share with you, but we'll leave that to another day. So let's get to the McKellar side. In the early 1900s, the old age pension was introduced in Victoria for those over 65 at 5 shillings a week. Now, this led to an exodus of the more able-bodied from the Geelong Benevolent Asylum, and by February 1923, the remaining benevolents were moved to the Ballarat Benevolent Asylum, leaving Geelong with no refuge for the elderly. David Drummond, in addition to his role today as the coordinator of spiritual care for the McKellar Centre for the past 12 years, is our expert on the history of this extraordinary site. So David, with Geelong no longer having a place for the elderly, there were many concerned residents of Geelong, and one of those was Mrs. Grace McKellar.
Absolutely. The McKellar family had taken up residence at Bell Park, the site of today's McKellar Centre, in around about 1920. And I guess putting the property into its original context, as you've got in that photo there, originally the property of Bell Park was owned by John Bell, who actually built the homestead and established this very sprawling. Up on the hill above there, right in the background, you can see Morongo, which became the girls' school and is now Canny International College. So that was John Bell's uncle built that property. So there is a rich family history there. But by around, or later on in time, the McKellar family itself actually acquired that property, or the main part of the property, what we can see basically in the screen there, with the Grand Homestead sitting on about 40 acres of land. And Grace McKellar had an interest in the welfare of older and underprivileged people, and along with many residents of the region, was concerned that the closure of the Benevolent Asylum meant that there were no suitable alternatives around Geelong for these people. And the practice of sending the elderly away from their familiar surroundings, from contact with family and friends, was increasingly unacceptable and perceived to be a scandal inside Geelong. And as this sentiment increased and the populations of Ballarat and Geelong rose, it became clear that there was a need for a public benevolent home within Geelong itself.
So what happened next?
Well, in 1944, so right towards the end of the war, there wasn't a great deal of spare government money around. So a public appeal was set up to support Geelong's first home for the elderly. And the chairman of the Old Folks Home Committee was Dr. Fred Wallace, who was then the mayor of Geelong. And with the support of the Geelong Advertiser and a target of about £55,000, they achieved that and then started getting together the process of starting up this old folks home. But during the appeal, there was an extraordinary donation. Grace, by this stage, had passed away, but her passion for the cause was passed on to her daughters. And in 1945, Miss Ernestine and Miss Catherine McKellar gifted their noble residence in Bell Park and the adjoining 40 acres to the appeal.
So that was 1945, but it took some time for it all to come together?
Yeah, but by around 1959, Grace McKellar House was open for its first patients, and the term Gracie's became a familiar phrase around Geelong and the Barwon Southwest. And more recently, with an expansion in the range of services offered, it was renamed to simply the McKellar Centre.
Right. And Dr. Wallace, who was the chairman of the committee, he wasn't forgotten in all this?
No, just inside our main gate, we have one of our wonderful residential aged care facilities that is called Wallace Lodge in honour of Dr. Wallace.
Right. So there's one remaining building or room from the original homestead, which still survives today. And we'll be asking you a little bit about that later on, David. So let's now fast forward to today. David Mead, your role is Co-Director of Community Health, Rehabilitation and Palliative Care at Barwon Health. First off, can you tell us a little of the services that are provided out at McKellar and what other rehab facilities we manage?
Sure, Francis. So good morning to everyone that's online. So the McKellar Centre houses a number of rehabilitation programs and facilities. So first of all is what we refer to as our Inpatient Rehabilitation Centre, which is approximately 100 beds. Now within those 100 beds, we provide inpatient rehabilitation. So for individuals who might have had a stroke, spinal cord injury, they may have had an amputation, with the goal of trying to get people as independent and as close back to their pre-injury or pre-illness selves as we possibly can to support their independence, ideally at home. We also have a number of beds which we refer to geriatric evaluation and management, and they're often for people who are experiencing I guess what we describe as diseases of ageing. So the ageing process has impacted their mobility, their cognition, their ability to care for themselves. So often they will have a period of time of rehabilitation and improvement with us to see if we can indeed get them home either directly or via another one of Barwon Health's many services. And then thirdly is our inpatient palliative care program, which many people will have had experience through friends and family, but it's a place where we care for people often in their terminal phase of life, whether they might have cancer or some other life-limiting illness. But also we often have people who come in here for some short-term respite for care relief in a palliative setting, and also to control symptoms where we might need some higher level medical management and oversight around symptom management and pain management particularly. They're our inpatient services. Also on site is an extensive range of outpatient rehabilitation services. So largely they are, I guess, an outpatient follow through to some of the care that people may have received as an inpatient. So, following a hip or knee replacement, again, following a stroke or an amputation. But we also have on site a number of specialist clinics in that setting, which includes things like a memory clinic, a motor neurone disease clinic, continence, and a more recent program that we've added that we're really proud of is our Oncology Prehabilitation and Rehabilitation program. So supporting people to receive intensive exercise before their cancer journey, before they start treatment, but also to help them recover from the consequences of the cancer and often the treatment they receive. And thirdly and finally, we have perfectly on cue, Francis, a purpose-built hydrotherapy pool. And so the Hydrotherapy Centre here is accessed by our rehabilitation clients, inpatient and outpatient, as well as by many members of the community through referral from their general practitioner. What that enables us to do is increase people's exercise in a supported and safe way through exercise in water. And it is one of the very few hydrotherapy pools in the region. And Francis, I need to get you to get a nice new photo because it looks a bit more schmicker than that now.
Okay. So I don't want to be distracted, but I will just flick through some photos while we continue talking with you, David. One of your main responsibilities is overseeing the operations at the McKellar Centre. So what does that role entail?
So I do that in collaboration with Ange. So very much focusing on those services that I spoke of then, and Ange very much focuses on the aged care facilities. So, in essence, we'll provide probably upwards of 2,000 episodes of care through those inpatient beds every year. And so we need to make sure that people are best supported to come into the centre when they need it and move on to that next part of their journey in their recovery when they need to as well. So we can provide more care for the community. So a lot of that, my focus is on the day-to-day operations, making sure that there's good processes for getting people over from the hospital, but also back home, and also day-to-day things around staffing, equipment, facilities, all of the things that make the care what it is.
So, David, how many staff work at the centre, and how many patients do we treat out there?
So we'll see upwards of 2,000 inpatients each year, and then close to about 7,000 patients in our ambulatory rehab settings, or outpatient rehab setting across our sites. And at any one time, we probably have close to 300 staff working across the programs.
Okay. Thanks for that, David. Ange Irwin also joins us, and Ange has responsibility for the Aged Care Directorate, as I said before, alongside Rob Mellon. Ange, can you tell us what the aged care setup is at the McKellar Centre?
Yeah, thanks, Francis. So we have 3 aged care facilities here at McKellar. So in Barwon Health, we have 4 overall, but one is located out at Chalmont called Alan David Lodge. The other 3 are located here at McKellar site. So that's made up of Percy Baxter Lodges, which is our oldest facility. So there's 5 hostels there that I believe hostel 1 and 2 were built in about 1961, 62, quite some time ago. And then 3 more of the hostels were built in about 1970. So that's a lower acuity facility that we have, and we currently look after 62 residents at Percy Baxter Lodges. We also have Wallace Lodge, which was mentioned earlier at McKellar Centre. So that's a high care facility, and we look after 108 residents at Wallace Lodge. So Wallace Lodge is probably one of the best facilities here in Geelong for looking after our really high acuity residents. We look after a lot of residents there that can't be managed in the private sector. So these are residents that have motor neuron disease, really high specialist needs. And because we staff all nurses at Wallace Lodge and we have access to really good medical specialists, we're able to care for them there. And we work closely with David's directorate as well. A lot of our admissions actually come via IRC or our in-house rehabilitation centre there at McKellar, so all through palliative care services. So once they're stabilised through palliative care services, if they're unable to go home to be cared for, then quite often we will take them to Wallace Lodge and provide care for them there and until they pass away. So there's a really good service there that we offer. The other facility we have here is Bakerston Lodge. So Bakerston Lodge is at the back of McKellar Centre, and that's home to 90 residents. Now, Bakerston Lodge is made up of two sort of separate units within that facility, and one is a dementia specific unit. So that looks after 45 residents there. So yeah, residents with complex needs. And once again, the residents that we look after in Blakiston Addison are often residents that come from other private aged care facilities, so they can't be managed in a normal residential aged care facility. So we often will accept them to Blakiston Lodge, Addison, and we are able to care for them there. The other side, we have Blakiston Oak, and that is a acute, well, it's not an acute, but it's a mental health facility. So we have, it's mental health aged care. So whilst they still need to be aged, we look after a wide variety of residents in Oak, but most of them have some kind of diagnosis of mental health. So we often work closely with Swanson Centre as well for our referrals into Oak. Yeah, so that's probably what we have here at McKellar.
So how many residents would you look after in total and at any one time? And what are some of the facilities and services that the aged care residents can access?
Yeah, so out here at McKellar Centre, it's 260 that we look after in total. And we also, we offer restorative care out here as well. There's some beds for restorative care that are located within Blakiston. So that's another service that we offer. Look, the access to a lot of different services. So here on site, we have, look, the same as everywhere. They're looked after by their own medical team, but we have access to aged care psychiatry services for our residents in Oak. We have pastoral care. We have pretty much access to any specialists that we need to, that calls in. Probably nothing. If they need imaging, that we have BMI on site, so our residents can access medical imaging on site, which is a really good thing. They don't have to go off to the hospital to get that done. We work closely, once again, with David's directorate to a number of our residents might actually go to rehabilitation here on site. So they'll go, if they've had a fall and they need rehabilitation, they'll go from our facility to IRC at times, and then once their mobility or condition has improved, they come back to us in aged care. We can access some of the community services. We can access palliative care services, pain clinics, a wide variety of services. Yeah, it's
wonderful, all the services, but also that the setting, you know, all the greenery, all the land. It's wonderful for the aged care residents to be able to benefit just from that alone.
Yeah, absolutely.
So what about support staff? How many staff have you got in aged care, and what sort of services are they providing?
Yeah, so we employ around about 400 nurses just for aged care out here at McKellar, and then we'll have about, at the moment, there's about 200 environmental services staff as well, which makes up a variety of different roles. We employ lifestyle staff, administration staff, so there's quite a big team out here across all the 3 facilities. Yeah. Right.
And what's the general demand for aged care services in the region? Is it, you know?
So look, there are a lot of aged care facilities in Geelong, which is good. We're really lucky. So there's a good amount of choice for prospective residents and families when they're choosing an aged care service to go to. We do have a high demand here at McKellar Centre for residents. We do have waiting lists, and we are full at the moment, and we have been consistently full now for some time. Mostly, since COVID has come along, the demand has actually increased for Barwon Health aged care services, because we did such a great job through COVID in managing, obviously managing our infection prevention services. And that's the other thing we do have out here, is really good access to infection prevention services. So we were the leaders, I guess, in Geelong when it came to aged care in terms of preventing COVID coming into the facility. So we would go out to a lot of private aged care facilities and advise them on what to do, because we had that resource available. So since COVID, we've actually had an increase in demand on our services, because they were out there in the community. Everyone was very happy with the way we managed through those times, and the way we still continue to manage and keep our residents safe.
So where are you up to with vaccinations for staff and residents? And can you tell us a little about how the aged care residents particularly have handled sort of the lockdowns?
Yeah, look, it's been really, really difficult, the lockdown, as you can imagine. So what's been going on, since March last year now? So it's been a really long time. When we were completely locked down, we moved to electronic telehealth, social media via electronic devices to try and keep in touch. We set up window visits for families. So we did what we could to keep everyone in touch, but it was a really challenging time. We actually put extra staff on just to provide extra social and emotional support to our residents, because it was hard. It was very hard, and continues to be one of the things we need to focus on. In terms of the vaccination, look, we did really well. So we were the first aged care in the region to be vaccinated. So we were vaccinated back in March of this year, and about 90% of our residents consented to that. So they were all vaccinated in the first round. But since then, we've had new admissions and others coming through. So we're actually going through a catch-up vaccination today. They're back out doing our new admissions. But the same with the staff. So I think at least 80% of the staff were vaccinated back in March, and some of the staff for medical reasons and a variety of other reasons weren't vaccinated, but most of those have now consented to vaccination, are getting done today as well. So we've actually got a really high rate, and we were all completed with our first and second vaccine by the end of March, because it was the Pfizer vaccine that we had in our aged care services.
Yeah, fantastic. Well, thanks, Ange. I mean, you just do a wonderful job out there. We really appreciate you spending time with us this morning. Now, we'll move on here. So we've talked a little of the past and the present at the McKellar Centre, but there's also a really exciting future. So let's have a quick chat with Jacob Beard, Head of Capital Works, and I might also ask Zoe Waters some questions as well. So, Jake, most of our audience would be aware of the campaign for the Kids Rehab Centre, and the Foundation is really proud that our board decided to press the green button on the commencement of construction, even though there's still a gap in funding. So, Jake, can you tell us where we're at with that project, and when we hope to see the new centre open for the kids?
Thanks, Francis. Sure. I guess firstly, I'll just put forward my appreciation to the Foundation as well for funding this amazing facility. It's going to be first rate when we get this built. So a quick update of where it's at. The builders have now set up on site. They've started digging in the ground, which is always good to see. We were going to have our lovely sod turn, but unfortunately COVID come along again and put that to bed, but we'll get there. So we're actually going to be putting down the slab on the 17th of this month. And then from there, it'll really shoot up quick. You'll see a frame within a couple of weeks after that. And you'll actually see it taking shape in the garden as well, and the rehabilitation garden.
That's fantastic. Sorry, go on.
We'd be looking to hopefully finish the build, COVID permitting, by the end of October.
That's wonderful. And open straight after that?
it'll be a period of moving across, but shortly thereafter.
Okay. Now, Jake, so this project was actually designed by kids for kids. So can you tell us a bit about that and what's actually included in the build?
Yeah, sure. It was a bit different. So historically, when we do these types of builds, we come into it with an infrastructure brain, and we look at what things we need to build rather than thinking about what people want us to build. So in this upfront of the design process, there was a human-centered co-design, and it focused on what people wanted rather than the viability and feasibility of those things. So you really get to know what the kids and the parents actually want out of a facility. And it sort of took on various aspects, but the main thing we looked at was look, feel, and therapy and care functionality. And what we came out of that co-design with is there was sort of four main, I guess, pillars we came out of it, was to create interest and character in the building, create an environment that's comfortable, safe, gives a feeling of safety and belonging, and brings people together and creates a sense of community rather than a clinical type of feel. And I think our design has really achieved that. It does feel very homely, but it still delivers all the clinical needs that you need of a facility like this.
Yeah, yeah. So you've got a group of 12 and 13-year-olds on your staff. Is that what the end result of this is? Or?
Not on my staff, but we did consult.
So Zoe, look, it was really was, as I said before, a brave call by our board to press the green button with the funds still required, but it was the right call. Tell us how important this facility is and where we're at with the fundraising.
This facility is so important, and the reason why it's so important is because Geelong kids deserve the very, very best. And it still amazes me that some parts of regional Victoria don't have access to the same facilities as metropolitan-born kids do. And right now in our region, there's 150 kids that are born each year that start out on life as happy, healthy babies and reaching their full health milestones, and unfortunately are diagnosed with cancer, childhood strokes or terrible accidents. And we believe, our Barwon Health Foundation board believe, as do everyone here that's on the screen, that Geelong kids deserve the very best. And we're just so grateful that the Geelong community share that vision and that passion with us, and have generously donated $3.45 million towards our $3.6 million campaign, which is nothing short of the perfect example that Geelong invest in our own, we look after our own, we care for our own, and that we want the very best for our young heroes that are born into our region every year. And my motivation is tenfold. We have at the foundation almost welcomed these young patients into our families. When we started the campaign in 2017, we met 3-year-old Keisha amongst other young patients. And Keisha was diagnosed at a young age with cerebral palsy. She's now in grade 1, and her family, Debbie and Shane, have been phenomenal supporters of the Kids Appeal. And we've almost seen Keisha grow up, and she will be a patient of this new facility, you know, for all of her young years through to her early adulthood. So we're excited that we'll be able to welcome Keisha through the doors, as Jacob said, before Christmas. So we're really excited, but we're mostly just grateful for Geelong sharing the vision that Geelong kids deserve the very best.
Yeah, and Zoe, in addition to the kids who are obviously going to benefit from this, it's also been a pretty important exercise for the elderly patients who've been undergoing rehab out at McKellar.
Absolutely. I'm sure that elderly patients and adult patients are just as excited as we are, because they will no longer have young patients running through the same rehab facility as they will be receiving care in. David Mead has probably, and I'll pass over to you, David, to share your story, but I'll never forget when we first started this campaign, David shared the story of a young patient almost refusing to go back to rehabilitation because he was scared that there was an elderly amputee, and the patient was nervous that become his life. So there's so many stories out there of why Probably don't need to go through them all, but there's so many stories out there as to why kids deserve their very own purpose-built facility rather than receiving care in an adult facility that was built and designed for adults.
Yeah. So, Jake, with such a massive site at McKellar, there's also a couple of other significant projects about to get underway out there. What can you tell us about those?
Where do I start? When it rains, it pours. So we've got a lot of work out at McKellar, as you said, probably close to $100 million of major works over the next 2 years. So those being, thanks for that. There's a little map of what's happening. You can see in our red section there, that's our McKellar Kids Rehabilitation site. I've got on there November 2021, but we'll try and do it by October. But you can see down the back as well, we've also got in yellow a $67 million acute mental health facility being built down there for patients aged 50 and above. And that'll basically provide a real release on pressure for the Swanson Centre in Geelong here. And it is part of the state's response to a Royal Commission into mental health, and our component of it is that 16-bed facility. We've also got the purple up the front there, which is an early parenting centre. That's part of 7 statewide early parenting centres being rolled out as well. Been fortunate enough to get one of those as well. So there's going to be 3 different builders on site, which will be fun for me to manage.
There's still room there for other buildings. I mean, it's quite an amazing site, isn't it?
It's huge. Yeah, we're very fortunate to have this asset. So, yeah.
Even though we're still in lockdown, and surely a lot of us don't have to rush off anywhere, I'm conscious that time is horribly against us. And I do want to get back to David and Zoe to discuss another really important project that's not yet public, but we might be able to give you a bit of a sneak peek which will be of interest, I'm sure. But before we get onto that, and having Zoe mention our tax appeal to get that extra $150,000, I want to have a few words with Samantha Butcher from the Canny Group. So welcome again, Samantha. Now, at the Foundation and at Barwon Health, we talk a lot about health. You also talk health, but more related to financial health. So coming up to tax time, will I get a tax deduction if I make a donation? And will I get one even if I'm a retiree?
That's a good question. And with all these amazing works going on, if you're in a position to contribute, that would be amazing. The short answer is yes. You can claim a tax deduction if you make a donation, but you need to have, for it to be a valid tax donation, you need deduction rather. You need to have income to offset that deduction. So even if you're retired, if you have investment assets or rental properties, for example, that create income, taxable income for you, a tax deduction will help offset that income. It is important to note, though, I know we can't plan this all the time, but it is important to note that it's only tax deduction if the donation is made before the recipient passes away. If the person has already deceased, it is still possible. It's just a little bit clunkier, I guess. The deductible gift recipient, the DGR, that you may or not be familiar with that term, they need to be named as a residuary beneficiary. It's a bit of a convoluted way to get there. Short answer is get tax advice. But yes, it is possible to claim a tax deduction even if you are retired, if you have other taxable income.
Okay. Getting your affairs in order, and obviously, you know, in an aged care environment, it's very important that people have their aged care plans in place. What about financially? You know, how important is it to getting your affairs in order rather than sort of waiting?
It is the most important thing to do. And I say this to clients when I meet clients for the first time, if I've met them for the first time or I've met them for the 10th year in a row. I say this to everybody. It's imperative that you have your will and power of attorney organised as soon as you practically can possibly do so, because so often, unfortunately, I see instances where this hasn't happened oh, well, I didn't think I had enough to worry about, or I didn't think, you know, I'm only 50 or 40 or 60 and I'm fit and healthy. Why do I need a power of attorney? Unfortunately, things happen in the blink of an eye, and all these people on the panel would attest to that. And it's just imperative that you, because we all have our, you know, good intentions of where we would like our money to go or our assets to go in the event that we have, you know, passed away. Just get it down, just get it down in writing. Power of attorney, again, imperative. If you don't do anything else, if you don't do anything else that I say today, go and get organise someone to be your power of attorney that you trust implicitly. It's important that you trust this person or persons with your life, because they will be making decisions for you in the event that you're unable to do so. So really think about who you nominate, but please get onto it as soon as you can.
Yeah, we dedicate July to legacy. It's our legacy month where we talk about bequests, and we'll have Samantha back during that month. We'll have a lot more longer to chat to her then. But in terms of bequests, I should also mention that during that month we do have free will writing. So if you haven't done a will, it's possible to get a free will written in that period. But in terms of bequests, can I bequeath my superannuation to charity?
Yes, but indirectly. So superannuation is actually separate to the rest of our estate. So if you go and create a will and you say to your lawyer, well, I would like everything to be split between my children, or I would like 50,000 to go to Barwon Health, and then everything, whatever your wishes are, superannuation actually sits outside of that. So we've got to be really careful that, yes, you can bequeath your superannuation to a charity, but under superannuation law, now I won't get technical too much, but it is important to know that superannuation law only allows us to nominate a certain number of beneficiaries, being your spouse, your children, someone who is codependent on you for health or finances, or your legal estate. Now, they're the only 4 people or entities that we're allowed to nominate, and obviously a charity is not one of those. So if your desire is to bequeath your superannuation to a charity, a charitable institution, you can just specify that in your will. So it means if you were to pass away, your superannuation nomination will say it'll be your estate. So you'll choose your legal representative, and then and that means your superannuation fund then goes to your will. And what does your will say? In your will, it can say, I would like the balance of my superannuation to be left to whoever.
Okay. Now, Samantha, this is a question without notice, and
yeah.
So you're a financial planner. I've got a son who's right into cryptocurrency.
Yes.
So I just want to know what your thoughts are on Bitcoin and the like, and do you have any clients that you know of that have actually had a crack at it?
So, that is a question. That is a loaded question, because obviously it's the buzzword, isn't it? Cryptocurrency, and we hear stories of people making squillions of dollars overnight. I don't have any clients with it. I personally don't have any myself, and that's only because, well, there's a couple of reasons. It's still very new, but more than that, the bigger reason is that it doesn't actually have a tangible value. It's not regulated yet, so it's still very, it's high risk. So if you're prepared to, jump in and be prepared to lose, give it a go. One thing I will warn, and if anyone's considering doing so, be careful when you set it up. Really make note of your login details, your passcodes, your whatever it is, because they are not recorded aside from you. They're not recorded anywhere else. So if you lose those, you have essentially lost access to that currency. There's no recourse. If we forget our password now, we might be able to email the provider and say, oh, look, can you reset my password? That doesn't exist at this point in time anyway with cryptocurrency. So if you are going to go down that path, just be very careful that you keep very accurate records.
Great advice. I think David needs a bit of a crypto trader, so I'm sure he's got his Bitcoin
No, you
well and truly sorted. But actually, there is a story about someone that has got apparently millions and millions in their crypto wallet or whatever it is, and they, as you just said, they can't access it. So
yeah, so essentially worthless. Yeah,
yeah,
unfortunately, yeah.
I can't remember my passwords when I log into Barwon Health, so I'd be hopeless at that. Thanks so much for that, Samantha. Really appreciate it. Now, if anyone wants to get in touch with you, where are you located? Where are the Canny Group?
So Canny Group, we're out at Federal Mills Complex in North Geelong.
Mm-hmm.
And we can help with, and as you've alluded to a couple of times, we'll be offering some free wills next month if you join on that webinar. But yeah, we're offering accounting, legal services, financial services, and then also we've recently added NDIS plan management as well. So come and see us out at Canny Group in North Geelong, cannygroup.com.au. We'd love to see you.
Terrific. Thanks so much, Samantha. We'll look forward to seeing you during Legacy Month. So now back to David Drummond. So David, we mentioned earlier that there's one remaining building or room from the McKellar homestead. Tell us about that. I think you're on mute, David.
I am, yeah, but I'm back now. Originally, if you remember back from the earlier photo of the building itself, at the back or the front right-hand side, there was this gabled roof that's either the dining room or the drawing room. But when the homestead, yeah, so that part just over to the right-hand side, when that building was demolished back in the 50s, we kept that one part, and it was using some of the bluestone. We built an entry area to it and a vestibule. So that now is our chapel and contemplation centre at McKellar. And at least externally, it's an incredibly beautiful building. It's constructed of the original bluestone. Well, of course, the room is, but the annex to it is in the original bluestone. And it's now draped. It looks a bit nude there. There it is. The ivy that surrounds it is from the captain's cook cottage. So it's got a bit of a local flair to that as well. And obviously and thankfully, it has a historical overlay over it to preserve it, but it offers us an incredible resource out at the McKellar Centre.
So the building receives a bit of use?
It is regularly used. I've ministered funerals there for some of our aged care residents. We've had marriages and vow renewals and commitment ceremonies, and it's lovely to see some of the old couples that have been through so much together. Towards the end of their life, they just want to renew their vows. So we use that as the space that we do that. And of course, we have regular faith services there so that our patients and residents can remain connected to those elements that have given their life meaning through them. But I often also find visitors and staff just enjoying some quiet space to recenter themselves when the world gets a bit shaky. Yeah. For myself, I often reflect when I enter that building on the McKellar family enjoying family space there, or maybe John Bell hosting a local feast. So it's one of those things that anchors me to the history of our centre, to the history of Geelong, and to the present expression of our beautiful space.
You know, I understand as beautiful as it might appear from the outside. When I say understand, I know it certainly is more than a little tired inside, David.
Well, sadly, yes. It was last renovated in the 1960s, and the 60s offered us a lot, but not a great deal in terms of current decor and suitability and flexibility. So it is a little dated inside, which is dated is perfect for the outside, but the inside could do with a little bit of work to make it more effective for our daily life at McKellar.
Yeah, well, I'm pleased and excited to say that we've been working with the palliative care team, Jackie White, plus Jacob Beard, Rowan Lovell from Building and others, and we've got some exciting plans, not just for the chapel, but for the palliative care unit at McKellar. So Zoe, you might be able to tell us a little bit about that.
I sure can, and can I first start by saying that we have had the absolute privilege of working with those people, Francis, that you've just mentioned. I personally have been blown away by their care, compassion, and the dignity in care that they provide to palliative care patients, but also their loved ones, children and families. And at any one time, there's between 200 and 240 patients being cared for by the wonderful team at Barwon Health Palliative Care Service. And we were approached earlier this year by the team in Pal Care to consider our next project to be a refurbishment of the palliative care unit at McKellar Centre, and to build a dedicated space for end-of-life care that is, I guess, complementary to the exceptional 5-star care that the clinicians provide each and every day. So we've got big plans for the year ahead, and although not yet a public appeal, we wanted to give the people on this webinar a bit of an exclusive insider view of what our plans are. We're aiming to completely overhaul, so to speak, the 12-bed facility at North Wing in the palliative care unit. We want to create a beautiful relatives lounge, a gorgeous garden lounge for people to enjoy the 40+ acres that the McKellar Centre offers our community. We also want to initiate a horticultural therapy program, which is an evidence-based therapy to engage patients in environment. We also want to create virtual reality experiences. Francis and I had the privilege of having a bit of a go at the virtual reality goggles that are currently across the health sector at the moment. And they essentially provide an escape for patients who are anxious or afraid, or for patients who desperately had a trip to Paris on their bucket list, but unfortunately would never be able to get there physically. These virtual reality goggles transport patients to a place that brings comfort and care in their end-of-life stages. We also want to create a reflection garden for many of the families that we've spoken about today in aged care, palliative care and rehab to come back to the McKellar Centre where their loved one was cared for. And the beautiful historical chapel, we would love to see that redeveloped to be able to see more funerals, more reflection ceremonies, and hopefully more vow renewals and marriages as well. And we estimate, and we'll be relying on the generosity of the community once again, to raise $1.2 million to be able to make that dream a reality. So although, again, not public, we did want to give a bit of an inside scoop on what our next project will be at the McKellar Centre from the Barwon Health Foundation perspective.
And we've got a very special prominent man who's decided that he would love to be the patron.
We sure do. I don't think this man needs any introduction in Geelong, but Mr. Keith Fagg has come on board as the patron of this project. Keith is an exceptional man. He's so passionate and dedicated for the people of Geelong, and he shows that in his role as a Barwon Health palliative care volunteer. He goes into the homes of palliative patients and captures their end-of-life journey, their milestones throughout their life, to be able to provide and leave behind a legacy document. He's a truly exceptional man, and we couldn't have anyone better to lead this project than Keith Fagg.
It's such exciting news, Zoe, and you know, our patients requiring end-of-life care deserve the very best, and we'd certainly love to share more details of this project with any of you if you're interested in supporting it. I'm an absolute superstar because we've got in under an hour. I can't believe it. I thought we were going to go for an hour and a half. We could talk about maybe Bitcoin for the next 4 weeks. You can explain to me what it actually is, because I don't know what it is. But anyway, thanks again to everyone for joining us. Our tax appeal will probably hit your mailboxes in the next week or so. So if you can, please dig deep so we can ensure that every last piece of necessary equipment is provided for the kids in the rehab centre. Thanks to all our panellists. Thank you for all that you do, and thanks for your time. And thanks for everyone who's joined us today. Please stay safe.